guys, for today's video, I'm going to demonstrate to you the preparation for childbirth. So first, check that all needed equipment, instrument, and supplies for essential newborn care are available. So these are the equipment and instrument and supplies for essential newborn. So step 2, place the baby linen and clothes under near the heater to warm them before delivery. The third step is perform hand washing. When the head is delivered, wipe the mouth and nose with gauze. So, ito yung gauze natin. When the baby is fully born, place the baby on a clean, dry towel or blanket on the mother's abdomen. Place na natin siya sa abdomen. And then, note the time of birth and sex of the baby and announce them loudly enough to inform the mother. So, 220 baby girl. Then, next is wipe the eyes and face thoroughly and dry the baby except the hands. And then, stimulate the baby while drying and rubbing up and down along the baby's spine with the heel of your hand. So, ganito. Next is assess the baby's breathing while drying and stimulating. If the baby is not crying or breathing well within 30 seconds of birth, clamp and cut the cord and begin resuscitation. And then if the baby is breathing normally, continue with the other components of essential newborn care. So next is remove the wet cloth and place the baby's skin to skin on mother's chest. So remove na natin to. Then ipe-place natin si baby sa chest ni mommy. Nasa chest na siya. Para sa kanilang skin to skin contact. And cover the baby with a clean, dry cloth including the head. Use bonnet if available. So kunyari ito ay bago ulit na towel. Then, lagyan natin ng bonnet kay baby. Ayan. So, next is wait for 2 to 3 minutes after birth or until the cord ceases to pulsate, whichever comes first. Before clamping and cutting the cord, then clamp the cord 2 cm away from newborn skin. So, 2 cm. Then, saka may kaklamp. 2 cm ulit. Ay, ano muna natin, push muna natin yung blood dyan sa place. Then, 2 cm. So, yan. Then, cut the cord between the two clamps using stereo scissor or blade. So, So, ito. Gamit akong blade. So, note 2 arteries and 1 vein. Ayan. So, next is place an identification band on the ankle of the baby, noting the name of the mother, sex of the baby, date and time of the delivery. So, kunyari ito yung identification band. The baby warm, ideally by keeping him or her in skin-to-skin contact on the mother's chest, with the body and head covered by a cloth or hat. So, skin-to-skin contact. Is injecting vitamin K and Hepa B dun sa bata. So, first, explain to the mother that an injection will be required to prevent hemorrhage in the baby. So, hello po, mami. Hiramin ko po muna si baby. Tuturukan po natin siya ng vitamin K and Hepa B para po ma-prevent natin yung hemorrhage doon sa kanya. So, okay lang po ba? So, okay. Yun, pumayag na si mami. Second is, wipe the injection site with the cotton balls with alcohol or cotton swab. So, ito yung injection site. Una is, wipe the injection site with the cotton balls with alcohol or cotton swab. So, dito tayo sa anterolateral natin iwawipe yung ano. Next is, inject the drugs intramuscularly in the anterolateral part of thigh, right and left, 0.1 cc for vitamin K and Hepa B, 5 cc, 0.5 cc for Hepa B vaccine. Inject na natin. So, dun sa kabila is ganun din yung gagawin natin. Wipe muna natin ng alcohol. Next is dispose the needle and syringe in an appropriate and safe manner. So next is instill ointment, tetracycline or erythromycin in each eyes. So ito, natin. Lagay natin sa mata ni baby. So, next is delay anthropometric measurement of the baby until he or she is stable and warm after the first breastfeeding. Na is, kukunin natin yung weight ng baby. So, wala akong pang weight. Head circumference, gamitin natin is cm. So, sukatin natin. Normal na circumference ng baby is 33 to 35.5. So, yung nakuha ko dito is 29 lang kasi maliit yung ulo ng baby. Para doon naman sa chest ng baby, ang normal ay 32-33 cm. So, yun nga, maliit nga yung baby. Yung nakuha kong chest size niya is 28 lang. Dito naman sa abdomen ng baby, yung nakuha kong size ay 28 cm. Is 42. The anthropometric measurement of the baby until he or she is stable warm after the first breastfeeding. Note and record the date information in baby's chart based on the recommendation of the facility authorities. So, next is remove the gloves and wash hands. Then replace and replenish the disposable items to be ready for the next delivery.